our panel. We're going to have a panel discussion on Dan Asia Pacific, yeah? Top divers question answer. I'd like to invite Mel. Mel on stage, Mel. Mel Sivai, could I have a round of applause for Mel, please? Thank you. Could I have Amelia? Giacomini, yeah. Hi, Amelia, how are you? And of course, Bayu Wardeo. Okay. This is a panel discussion on Dan Asia Pacific, and of course, it's all about top divers question and answer. So in the meanwhile, please enjoy this segment and listen up, for we have a lot of interesting, vital information to be learned, yeah? Thank you very much. The stage is yours. Bombs away.
Still loading, guys. Still loading. Oh, it's part of this, though. It's all part of it. We just had the intro. Oh, thanks, Chief. Is there volume? Guys, is there volume? Is there volume? Hi, and thanks for joining us today. As was mentioned, I'm Mel. I'm the Regional Director for Dan World here in the Asia Pacific. Amelia is our Business Programs Manager, and Bayu to my left is our Manager in Indonesia, and he is also a Dan instructor. So we wanted to use this time today to address some commonly asked questions. But before we do get into those, one question that we do get asked here in Malaysia, is Dan an insurance company? And to that we always say that first and foremost, Dan is a diving health and safety organisation. And as part of that, yes, we do offer an insurance product. But to explain more about everything that Dan does, here's another video for you. Is that okay? I can see it there in the background though. Is it working? It's still loading. Still loading. Oh, what happened?
Before you wake up.
Hey?
It's always happening.
Do I need to do anything?
Well, while we get the video up and running, we can have a chat amongst
always happened,
ourselves.
right?
Sorry guys, apparently some IT issues. Typical. What should we Guys, is that loud? What's our first section? Do I want to... Oh, she's cracked it then. So we might need to skip it. Oh, that's a shame. Skip the video. No, just give her 1 second. That's a shame. Do you know what this is? This is actually part of it. Sorry, everybody. Do we just skip it? And here we go.
Before you wake up. Before you pack. Before you leave on your trip. We're here, working to make diving safer. Medics, doctors, 24/7 emergency hotline staff, experts who have handled over 10,000 emergency medical evacuations. It's that tireless dedication and expert management of care that give divers confidence to explore freely, to see the world from a new perspective, one that most never experience. Knowing that if there's an emergency, someone will be there to help. knowing they have a safety organization by their side every step of the way. An organization with a network of the world's best dive medical professionals and recompression chambers. An organization that conducts continuing medical education courses to improve treatment for injured divers. An organization that has spent over 40 years building its reputation for dive safety. At DAN, your health and safety drive everything we do.
Well, I hope that does provide a good insight into Dan. So the first question that I do want us to look at is first aid for diving accidents. Bayu, as a Dan instructor, is the perfect person to firstly just provide a bit of an insight about decompression illness and why it arises. So for now, I'll just hand you over to Bayu.
Yes, thank you, Mel. Yes, actually, DCS can happen to anyone, any diver at any condition. So nobody is prone to DCS. So this is what happens when you have a DCS. You will have rash like on your skin. You have symptoms. You have signs, which is it's there. I mean, you don't need to hesitate to contact them if you have any this kind of symptoms. Please next now. Yes, this is the common symptom of sign and symptom of DCS, which is starting from joint pain, fatigue. Sometimes you feel not normal fatigue, not like usual. It's not like just after diving and you feel normal fatigue. It's more than that, because I've been there, and maybe after this, Amelia will also share.
We've got a story to share.
The story.
Or you have to have a nap after every dive. Maybe that's unusual.
Yes. And sometimes skin itching is not. Some people feel normal about skin itching, but it might be a symptom as well for DCS. So also you shortness of breath. It's also possible. And then please, Mel, can you next? Yes. And this is why we're keep promoting to have oxygen, onboard oxygen unit on your every dive trip. So you should ask every dive operator, liveaboard, anything. If you are in a diving community, dive club, you should have at least one oxygen kit, because this is the most effective way to have the first aid for any DCS symptom. And after you realize that you have a symptom or sign, you can call the hotline. We have it. Please come to our booth to have the stickers and the tag. It has Malaysian local number, so you can contact using local number, and you can ask for advice. There will be a doctor answering your question and give you guidance. And the most important is to have the oxygen, and then after that, seeking medical attention. Next, Mel. Oh yeah, yeah. It's okay. The most important is giving to know how to give the oxygen. You have to know the correct fittings. You have to know the correct mask, which is if this is not a normal mask, but we don't recommend using the nasal cannula because it's not effective enough. And the best possibility is having the DAN mask, which has the non-rebreather mask with our oxygen kit. It has the regulator. It has second stage, which is you can use it as on-demand valve. So the flow rate should be at least 10 liters per minute, or if possible, you can give 15 and 20 if your oxygen unit can deliver that. In then regulator, there's a switch, so you can see clearly what flow rate you give to the victim. I think that's it, Mel?
I do think it's important to also mention
Yes.
that we have heard of cases, though, where operators have provided flow rates of, say, 5 to 7 litres per minute, and we know that that's extremely ineffective, and their intention is to try and preserve the duration of that oxygen, but we know unless it's provided at these higher flow rates, it's not going to have that same impact. So if you are given oxygen first aid, this is a great tip for you to be aware of. Ensure it's at this 10 to 15 litres per minute flow rate. And another tip that we suggest is before you book your next dive trip, ask some questions of the operator. After all, this is your own health and safety and your life. Do they have oxygen? Do they have someone who is actually trained to provide oxygen? Are their tanks actually filled? Is there oxygen available at the dive sites? So these are the things, simple things that you can do to ask that will ultimately look after your own health and safety. So please keep that in mind.
And we have the training for oxygen provider, right?
And we have trainers and instructors right here, so you can learn.
We have also instructor in Malaysia, right? We have some instructor.
Yes, with
Dan
NAUI as
instructor.
well, powered by Dan. They use our training, so please go and speak to NAUI as well, and they can hook you up with instructors locally so that you can gain these skills and be aware of what is needed. So I'll pass you over to Em now, because another question that we do get asked is about flying after diving, and obviously this is also critical to avoiding decompression illness.
So how soon can I fly after diving? Well, as Mel suggested, it's, is it on? Am I on? Go on. My voice will carry anyway. So how soon can I fly after diving? So from research undertaken by Dan, we developed the Flying After Diving Guidelines. And these are the guidelines that recreational divers use and the dive training agencies use worldwide. Now, the suggested minimum surface intervals for a single day, no deco dive, minimum 12 hours. More is better. For multi-day or repetitive dives, repetitive no deco dives, at least 18 hours. Again, more is better. Always building that little bit of extra just to be certain that you're safe to fly. Now, if you've done mandatory deco dives, again, at least 24 hours. So, you know, the rule of thumb that most divers use is just wait a day. Wait at least one day before you depart. You know, you join your flight and then head to your next destination. And that's why longer surface intervals will further reduce the DCS risk. Have I missed anything?
Great, Em. Okay, so exercising after diving. So while you may feel good post-dive, ultimately the diving has still stressed your body. So for this reason, we don't recommend that you do any strenuous exercise after diving. Sure, go for a walk on the beach, but do you need to run 10K? No, you don't. Go for a gentle swim. Enjoy your afternoon. So yes, you can take it easy, you can do some gentle exercise, but nothing strenuous.
Lay by the pool.
Lay by the pool. Recommended by Em.
Enjoy your holiday, right?
Enjoy your holiday.
Yeah, enjoy the rest of your holiday, that's right. Another common question we get asked is how soon can I dive after general surgery, okay? So general surgery doesn't mean any sort of major organ surgery or any surgery to joints, any pins that are inserted, any spinal surgery. That's considered major surgery. So today we're just talking about general surgery. So just don't dive until you're completely healed and pain-free. Wait until you get your clearance from your surgeon to resume activity, normal activity without restriction. You may still need time to recover your strength and stamina and exercise capacity as well. So just listen to your body. Just ease into it. Everyone's different. So just, again, it's your health and you decide when you feel it's right for you to jump back in the water. Consider a cautious approach to your initial dives. You know, don't go booking a liveaboard, doing 5 dives a day. Just, you know, start slow, do some nice build-up dives. Take the opportunity, if it's been a while since you've actually dived, might be a good idea to do a bit of a refresher, check all your equipment. You know, you might want to, you know, just book a check dive with your local dive operator or dive club. I've done that before when I've been out of the water for a significant period of time. So again, start in a controlled environment. You know, as I said, don't go book a liveaboard to Raja Ampat or something like that. Dive where you feel comfortable. I know I did a series of shore dives just to sort of get myself back into the swing of things. So, you know, everyone's healing process is different, and it sometimes does take longer than what we would like. Be patient. That's the key.
That's the hardest part.
That's the hardest part, was for me. And follow the recommendations, and that, you know, that means that you're going to have a really successful first dive when you actually get back into the water.
And enjoy it.
Enjoy it, yeah.
Thanks, Em, that's great. So, Bayu,
Yes.
tiredness after diving,
yeah.
is it normal?
This is always a question from almost everyone. How to differ normal tired or any non-normal tired. So tiredness. So this is very common when the tiredness level of person to person is very different, and there's factors for individual fitness, like your thermal stress when you dive in somewhere quite cold, like below 24 Celsius. It will give you more tiredness than usual. And sometimes gear constructions, it's also, you can add into the tiredness, because I know some people are using side mount and it will give you tiredness to balance your tank, to adjust your tank, and it will give a different level of tiredness. But tiredness in DCS, you can feel it because you are not, you've been diving before, and you can feel directly that this is not normal. It almost feel like deep exhaustion, like you haven't been in this position before, and when you're normal diving, you know your level of tiredness, and this is different than usual, and that could be very positive sign of DCS. And also, sometimes you can feel that after carrying your big rigging of your tank, or maybe your big camera, you feel something like twinge or something, and
Pulling.
yeah, most people feel that that's normal, but it's an early sign of DCS, and when it going more and more, so you have to contact them for
And
more.
perhaps combined with other symptoms then too.
Yes, of course. Okay, that's it, ma'am.
Thanks, Bayu. Now, this is a very interesting area and something we get asked about at every show that we do go to. Why doesn't Dan publish or share chamber locations and information? Pure and simple, we have had cases of divers driving by perfectly good healthcare facilities to go to a chamber that they know about, only to find out that it's closed, there's no staff there, and then they think, what do I do now? So Dan does not recommend going to a chamber that you know is just around the corner or whatnot. The best option for any injured diver is to use the best locally available medical services, because not everything that can happen in the water does warrant recompression. So the first thing you want to do is get a physician to actually review you and rule out other potential illnesses, whether that be a heart attack and anything else, neurological or musculoskeletal injuries that could actually be confused with DCS. So advanced diagnostic procedures will rule out complications, whether that be a collapsed lung or something else, and other factors that could actually make recompression dangerous. That is something that we want to avoid. Jumping into a chamber is not needed for everybody, and it could be dangerous. So we want a physician to first review the diver and make sure that they can actually withstand recompression therapy. So please take that on board, and that is a critical reason that we are just not passing on this information. Call Dan. But there's more. And I'll pass you over to Em.
So another consideration, and very important consideration, is the chamber's capabilities. So the closest chamber may not be the most appropriate. So Dan will always look at the diver, what they're experiencing, and what their medical needs are. So again, not all chambers are the same. Not all chambers have all the same facilities. Someone who has a very serious decompression illness may need that higher level of care that is not available at a chamber that doesn't have a high HDU unit attached to it. So that's why another consideration. The chamber's operational status can change at the drop of a hat. Chambers close all the time for scheduled maintenance. So again, we don't want you driving 3 hours that way only to find that the chamber's closed. Then you're in trouble.
Exactly.
So call Dan. Dan has got all the information of what is up and what is down. The chamber just may not be available just for any other reason. There could be an internal situation that's happened at the facility that has closed a chamber for a period of time. And again, that's unscheduled. Sometimes prior notification from the evaluating facility is required to begin that call-in procedure where they actually have to call in the technicians and call in the doctors as part of the treatment team. Most hyperbaric facilities have regular daytime business hours and sometimes are not staffed on evenings or weekends. So again, you could show up at a chamber, find it closed, and then what do you do? So just call Dan. Dan will look at the diver's condition, your condition, and make a plan according to that.
And as we had mentioned then too, Dan maintains a recompression chamber network. So part of what we do is that we collect information from chambers all over. So you don't need that information. That's what Dan has. So we collect the information, what facilities they have, who they're capable of treating, what their hours are, et cetera, so that you can rely on us. When you speak to our medics, whether you're a member or a non-member, you'll speak to our medics, they'll ask where you are, they'll ask about your symptoms and your condition, so we can actually determine where we do need to send you based on the level of care that you need. So always keep that in mind. Dan is here as a service for all divers, for all the community. Rely on us for our advice. We are there for you. So, this is another...
Why are you all laughing at me?
This is your
We'll get to that. So this is another common area that's coming up a lot in the last few years for us. PFOs, patent foramen ovalis. Essentially, they are a hole in the heart and it's failed to close then after birth. So essentially that is a trap door then, which is open then and letting blood flow into the left atrium. So I'm missing my information there. So it means though the people that have this, they don't know that they've actually got this. So you don't know that you're born with a hole in your heart until something goes wrong. And even then, it really does require a lot of investigation and diagnosis to find out that you've got a hole in the heart. Essentially, people that have this are 2.5 times at greater risk of developing DCS. They're at 4 times greater risk of neurological DCS. But what they can do if they have a PFO is stop diving, close the PFO, or dive more conservatively. Now, you might think that because we work at Dan that we're immune to any decompression illness or anything else that goes wrong. But we're here to tell you that that's not the case. And for that, I'll hand you over to Amelia.
Now, the reason Mel's handed it over to me is because I actually had a PFO. Didn't know I was born with it. As we said, it's a congenital heart defect. And yeah, didn't realise I had it until I actually got bent and had quite a significant skin bend. So earlier we were talking about rashes, different presentations of decompression sickness. Mine presented, I'd been diving for about 5 years prior to this happening and no issues up until that time. And then I booked a trip to Lumbin in Bali and dived the wreck. That was the plan. And after the first day of diving, I noticed I had a little bit of an itch on my torso, and I thought, oh, okay, could have just been, you know, the wetsuit. So, you know, just carried on the next day, felt fine, carried on the next day, went diving.
Some would call that in denial.
You know, went diving, dived on nitrox, dived within, you know, the limits, did 3 dives, a little bit more challenging and a little bit longer. Finished my day of diving and my rash was a mottled, blotchy, purple situation on my torso and on my back and on my chest. And I thought, oh, what's this? So, you know, I looked to my dive operator and I said, oh, you know, I think I'm in trouble here. I think I've got, you know, skin decompression. No, 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 it's okay. It might just be a rash. And I thought, no.
Keep diving.
I think this is something more serious. So anyway, the rash disappeared overnight and I made the decision, you know what, I have to call Dan. I need advice. I know something's wrong here. So I called Dan and they then suggested what I needed to do was to go on oxygen and monitor the symptoms. I did that, went on oxygen, the rash disappeared before my eyes and they said, okay, stop diving, which I did. I enjoyed the rest of my holiday. My plan was actually to go to Manta Point to dive, but I cancelled that. I thought it's not worth my health. I need to find out what's going on. So on my return to Melbourne, to Australia, I went and saw a cardiologist and I had the diagnostic test because they suspected that Dan suspected that I had a PFO. So not only did I have a PFO that was 5 millimetre wide, I also had 2 other holes in my heart. One was 4 mil and one was 3 mil. So above and below the PFO. So I was like Swiss cheese. That's what the cardiologist said. It's like Swiss cheese in there. I said, okay, what do I do? Can I still dive? He said, for you, because of the severity and because it's a full ASD, atrial septal defect, there is no safe level of diving for you. So if you do not get it repaired, you can no longer dive. Well, not diving was not an option for me. So I had it repaired. I had a device put in, so it just closes up all the holes. Didn't dive for 3 months, for 6 months, had to be on blood thinners for 3 months. You know, I was a little bit worried, I'll say, because it is an invasive procedure, and like any other invasive procedure, there are risks, but the risks were, for me, I was willing to take those risks, and it turned out perfectly. So...
And you've now had no issues?
I have no issues since. So, you know, I was cleared to dive. I still build in my own level of conservative. I still build in 2-hour surface interval for myself, and I don't dive below 20 metres. Again, it's just, for me, that's my decision. I am anatomically normal, they say, now. Our COO is saying, no. But, yeah, so, but, you know, the take-home message for me was getting back to when I was at the dive centre, when I was going through all the symptoms, I asked for oxygen. They had to look for it. They found the oxygen unit. They put me on nasal prongs. I said, no, 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 no. I've done the oxygen provider course. I know that's the wrong delivery system. So again, they found an NRB mask, a non-rebreather mask, put that on me. They put me on 4 litres of oxygen. I know that that's not enough. So I cranked it up to 15 litres. So again, through my, my oxygen provider course that I took with Dan, as part of it, Dan's staff, we're all encouraged to take those courses. I knew that what they were doing was wrong. And I then followed, I called Dan, I got the advice that I needed, and, then it happened that, I had this condition that I didn't know anything about. Had I continued diving and gone to Crystal Bay, the outcome would have been
Yeah, a lot different, perhaps a lot worse for you.
very different.
Yeah.
So, yeah. So, look, if it happened to me, it can happen to anyone. These things are not planned. So, it's important.
You certainly don't expect to be one of those 27% of
No.
the population that does have a hole in your heart.
No. So,
Thank you, Em. That's
yeah.
amazing. Yeah.
Yeah.
Thanks for sharing. And that's another takeaway then, as Em said, the nasal prongs that they try to put in your nose are completely ineffective. You're losing so much of the effectiveness then. So you need something that is covering your nose and your mouth and having that suction there. So you could even have a mask that you take along with you on the what are the chances that something could happen to you. But a takeaway is if someone tries to put nasal prongs on you, you say no, and you try to get a better mask that you know is going to do a more effective job. And you're welcome to come over to our booth and ask us more questions about any of these things. So the next thing we'll move on to is now what do we do if we actually suspect a serious dive-related injury? And Bayu will just speak to that briefly.
Yes. First of all, don't play doctors, even if you are a doctor, because you need diving physician that knows your problem. You need diving medic team to analyze, to have a diagnose. So the better option, first of all, before you're doing anything, contact them. Contact the emergency hotline. You have the, like we told before, we already have the local Malaysia number, so we can contact anytime. And it's not only for DAN member, it's for everyone. Even for a non-DAN member can contact, they can ask for direction, they can ask for anything. And behind the emergency hotline, there's a lot of our referral physician. We have a doctor team in Malaysia as well. They were very good team. Dr. Andrew Ang and his team were very great. They were also a diver, so they know what is happening with you. And of course, when you stop by at Dan booth, we can give you a sticker and tag that shows what to do if there's an accident. So monitor like simple thing like monitor the diver airway, breathing, circulation, give oxygen, and contact the local emergency service. So that's all you can do. Give it to the paramedic and the medical service. They will help you. And on that area, on that situation, then hotline will communicate with the emergency service. So they will be the diver will be on a very good hand. So that all I can say, Mel.
Thank you, Bayu. That's great. So Bayu did touch on this, but the question is who can call Dan's 24/7 hotline? Now, Dan is here for the entire community. So anybody can call the Dan hotline, and we recommend that you do. We've got in-house medical teams waiting there to receive your calls and to provide you the advice that you do need. So Dan will always provide advice and support to any diver, dive operator or medical facility. And often the time when you do go to a hospital or a medical facility, they're not trained in diving medicine, so they really don't know what to do with a diver. So you as the diver could say, call Dan for me, and our doctors will speak with the doctors at the hospital or the medical facility, and they'll appreciate that guidance. If they haven't seen cases of decompression illness before and they haven't trained in it, how are they to know the unique nature of decompression illness and other diving injuries. They're not. So use our service. We are here to help you as the diving community, and it's a free service that we do for the community.
And
So, go on.
it's better when a doctor communicate with doctors, so they speak same
They
language.
speak the same language and they will really appreciate it, and the ultimate picture is that it's going to benefit you and get you to the care that you need quicker, and really that's what it's all about. The quicker that you can get the care that you need, the less serious the symptoms are going to be, and ultimately I think that's the objective for everybody if you do experience decompression illness. So Dan does help everybody in the community, but ultimately we can only organise treatment, arrange evacuations and pay for all associated costs for our current DAM members. So if you're not a DAM member and you'd like to learn more, just pop over to our booth. We're just up one of these aisles here.
Lane 3.
Lane 3.
Okay, well, that's it. So thank you everyone for your time. If anyone's got any questions, please come visit us. We're at booth A115. Please come learn more about our dive assistance packages. You can also ask us about how you can learn to be an oxygen first aid provider. Come and collect free tags with our emergency hotline numbers on there, critical to have. We've got stickers as well. Put the number in your phone. You're never going to know when you need us, okay? And you're going to need us when you need us. So, like,
When you least expect it.
yeah, when you least expect it, and you know it can happen at any time to anyone. So you might have to call Dan for someone else. So please, you know, keep that in mind. And also, you know, if you come to our booth and you actually join, you take out one of our dive assistance packages, you actually get a free T-shirt as well. So,
Great job, Em.
yeah, so-
Thank you, everybody,
Thank
for
you,
joining us.
Thank you,
Really
everyone.
enjoyed speaking
Thank
to you.
you.
Thank you.
All right, round of applause, please. Thank you, Mel. Thank you, Amelia. And thank you, Bayu.
Thank you.
That was good knowledge, actually. I learned something new because I got 3.
So she got 3 too.
I'll talk to you later.
Oh my God, I enjoyed that.
All right, commencing shortly, we're going to have a very, very special segment. It's called Screening of 50 Hours Underwater, a dive for hope, yeah? And of course, to the members of the public, and of course our visitors, a very good afternoon. Welcome to the second day of the Malaysia International Dive Expo, commencing from the 7th to the 9th of June, 2024. And of course, do not miss out on this special segment where it's all about 50 hours underwater, which I believe Shah is going to elaborate more on this. And of course, we'll be having the lucky draw commencing the time of 6:30 in the evening. So purchases lucky draw. The more you shop, well, we have 25 prizes to be given out for today. Yeah, right. So the meanwhile, commencing from the stage as early as 10:30 in the morning, right up to the evening. Our stage is full of forums and of course our presentation talks. Stay tuned for the updates coming up.